Nose cancer causes and treatment. Nasal or nose cancer typically refers to tumors that stirred in the paranasal sinus or nasal cavities. It is relatively rare and can go undetected until the tumor is large enough to block the airway or spread beyond the nose. When a tumor or cancer develops in the nose, a person will often develop symptoms that can include congestion, postnasal drip, and pain around the eyes. This video reviews nose cancer symptoms, staging, and more. Nose cancer symptoms. Nasal cancer can cause several symptoms that resemble those of different benign conditions. In fact, diagnosis often occurs due to a person investigating the cause of their symptoms, thinking it may be a common cold or infection. Some common symptoms can include pain above or below the eyes, nasal congestion and stuffiness that never improves and may worsen, nose bleeds, changes to sense of smell, hearing loss, blockage of one side of the nose, postnasal drip or mucus in the back of the nose and throat, numbness or pain in parts of the face, bulging of one eye, pus draining from the nose, numb or loose teeth, mass or lump on the face, nose or palate, change or loss of vision, constant watery eyes, headaches, pain or pressure in one of the ears, enlarged lymph nodes in the neck, difficulty opening mouth. Stages. There are a few different ways to stage cancer. The American Joint Committee on Cancer, or AJCC, TNM system is the most prevalent. This system assesses three features of cancer, including tumor, the size of the tumor, how far it has spread and its growth rate, lymph nodes, whether cancer has spread to the lymph nodes and how many it affects, metastasized, whether cancer has spread to other organs or distant areas of the body. Doctors may group the cancer into stages 0 to 4. The TNM system then further describes the tumor, lymph nodes, and metastasized status in groups 1 to 4. In general, nasal cancer stages look like this. Stage 0. The tumor is small. It has not affected the lymph nodes, nor has metastasis occurred. Stage 1. The tumor has grown larger, but there is still no lymph node involvement and no metastasis. Stage 2. The tumor has grown in size and now affects more areas of the nasal passages. There is no lymph node involvement or metastasis. Stage 3. The tumor has grown outside the nasal area. It may or may not affect the lymph nodes and no metastasis has occurred. Stage 4. The cancer is advanced. There may be the presence of metastasis, advanced local spread, or significant lymph node involvement. The stage subdivides into 4A, B, or C depending on the TNM staging. Causes and risk factors. There are several potential causes and risk factors associated with nasal cancers. This include tobacco use, exposure to certain chemicals and substances including wood dust, leather dust, and smoke, inherited or acquired gene mutations, high-risk human papillomavirus or HPV. Treatments. Treatments can vary for nasal cancer. Factors that can affect a person's treatment plan can include age, tumor size, which surrounding structures the tumor affects, whether it has spread to other areas of the body, overall health. The main types of treatment for nasal cancer include surgery to remove the tumor, radiation therapy, chemotherapy, immunotherapy. A doctor may also recommend participation in a clinical trial. Clinical trials test new forms of treatment to test their effectiveness and safety. Treatments can cause side effects. A doctor may recommend additional therapies to help alleviate symptoms associated with treatments such as chemotherapy or radiation. When to consult a doctor? A person should contact a doctor if they experience unexplained nasal congestion, post-nasal drip or headaches, and these symptoms do not go away over time. A person should also seek medical attention if they experience changes in vision, double vision, severe nosebleeds, loosening of upper teeth, trismus, or the inability to open the jaw, facial pain. Though the cause may be a benign condition, a doctor may be able to help rule out cancer. Most cases of nasal cancer occur in people over 55 years old. It is also more likely to occur in white people and males. How common is cancer in the nose? Nose cancer is not common. It accounts for only about 3 to 5% of all head and neck cancers in the United States. Head and neck cancers account for only a fraction of all cancer types. Is it possible to detect nose cancer early? Early detection is possible, but it does not occur often. The American Cancer Society notes a few main reasons for the delay in diagnosis. The symptoms are non-specific and far more likely due to common illnesses or conditions. Symptoms do not typically start until the cancer has grown in size or potentially spread to other areas in the body. Nose cancer is relatively rare.